This is Janice Nathalie, Dr. Nathalie, talking about health-related quality of life in pediatric patients with vitiligo. I know a lot of times we talk about adults. I know from my clinic, pediatric patients have very different outlook, and sometimes they don't care as much as adults, and sometimes they care more. And so I'm interested to hear what you have to say, Janice. Thank you.
Hi everyone, my name is Janice Nathalie and I'm a resident medical officer from Australia. Today I am presenting our study, which is a systematic review and meta-analysis of the health-related quality of life in pediatric patients with vitiligo. I have no conflict of interest and no funding to declare. The global prevalence of vitiligo has been reported to be around 0.2 to 1.8%. Vitiligo usually first appears in childhood and adolescence, with studies showing disease onset before the age of 20 in almost 50% of cases, and 32 to 40% before the age of 12. Vitiligo has been reported to have a significant impact on the quality of life. Our primary objectives are to systematically evaluate the quality of life and determine the predictors of quality of life in children and adolescents with vitiligo. Our secondary objective is to explore the impact of pediatric vitiligo on the quality of life of parents and caregivers of the affected children and adolescents. We conducted a literature search on PubMed and Medline and Embase on the 24th of July 2020. These are the search terms that we used. Articles were included if there were original research papers written in English that reported health-related quality of life of patients under the age of 20 with vitiligo, or reported the health-related quality of life of parents and caregivers of children and adolescents with vitiligo. We then performed data extraction, quality assessments, and meta-analysis. After a study selection process, 20 studies fulfilled the inclusion criteria. 3 studies provided detailed scoring for each question item of the Children Dermatology Life Quality Index, and we performed a meta-analysis involving these studies. The studies originated from 12 countries. Most studies were cross-sectional in design and were conducted in a hospital setting. 16 studies fulfilled our primary objectives, 3 fulfilled our secondary objective, and 1 study fulfilled both primary and secondary objectives. The following data concern the 17 studies that fulfill our primary objectives. Altogether, there were 885 participants. The mean age varies between 10 to 19 years old. Disease duration were between 3 to 5 years. There were 6 health-related quality of life assessment tools used in total, and the Children Dermatology Life Quality Index is the most used tool. A total of 429 participants were included in this meta-analysis. A high degree of heterogeneity was detected in almost all domains, with I-square of 81 to 98%. From our meta-analysis, we found that children and adolescents with vitiligo struggle most with self-consciousness and embarrassment, as well as teasing and bullying. They are least affected in the domains of school and holidays and sleep. 8 of 12 studies that provided detailed scoring for each domain and subscale reported the emotional domain to be the most affected. When we look at the total health-related quality of life scores for each tool, we found that most studies concluded vitiligo having an overall of no impact or mild effect on the quality of life. However, 1 study included patients' subjective reports of how vitiligo has impacted their lives. This study reported that 66% of their participants felt bothered or concerned by their vitiligo. 93% had been approached by people who mentioned their skin, and 29.7% had avoided a social situation due to their vitiligo. This same study found an overall mild impact on the quality of life when the quality of life was assessed using the Children Dermatology Life Quality Index. Another study found that pediatric patients with vitiligo have a significantly higher prevalence of psychiatric disorder compared to the healthy controls. This is despite the pediatric quality of life inventory result concluding vitiligo to have no effect on a patient's quality of life. There are 4 factors that are likely to negatively affect pediatric vitiligo patients' quality of life. These are adolescent age, facial involvement, extent of body surface area affected, and concurrent psychiatric diagnosis. 4 studies assessed the impact of pediatric vitiligo on the parental quality of life. These studies demonstrated that parents of children with vitiligo tend to have worse quality of life and are more likely to develop depression compared to parents of unaffected children. The main limitation of our study is heterogeneity of the health-related quality of life assessment tools and the methodologies used in the published studies. The lack of consistent quality of life assessment tool in children with vitiligo makes it difficult to assess the true burden of disease on a large scale. In conclusion, Factors that are most likely to affect quality of life negatively are adolescent age, greater body surface area involvement, facial involvement, and concurrent psychiatric diagnosis. A multidisciplinary team approach should be adopted in vitiligo management plan, and parents and caregivers should be involved. Clinicians should be aware of the parent-child diet and their intricately linked quality of life and seek to offer counselling to caregivers as well. Most pediatric health-related quality of life assessment tools focus on the assessment of physical symptoms and day-to-day participation functioning. However, our data showed that vitiligo's greatest burden of disease is in the emotional domain. This highlights a need for a validated pediatric vitiligo-specific quality assessment tool to truly capture the burden of disease. Lastly, I would like to acknowledge my colleague Dr. Jaewon Chang for his assistance and my two wonderful supervisors, Professor Khalid Dean and Dr. Michelle Rodriguez, for the guidance and opportunity. Thank you for your time and attention.
Thank you, Janice. Great talk, important study. I think that there's a lot of variability. How a 3-year-old feels about her vitiligo versus a 12 versus 18. And a lot of times I have patients who come in and the 12-year-old says, I hate the light booth. I don't want to use it. I don't really care about my vitiligo. And the parents are really worried that maybe she will care when she's 18 and that things change. And so the perspectives change over time. Did you get a feel for that really indicates or suggests that depending on whether you're studying mostly young children or adolescents or teens, you may get different results. Was that a source of variability in the studies that you looked at, or can you tell?
So some of the studies, they do like an age stratified analysis, and it seems that the adolescent children, particularly, they struggle the most, not so much with the younger kids. That's what we found, yeah. Interesting.
Yeah, adolescence is such a tough time. Just adding something else on top of it makes it difficult. Darshan Singh in the chat said that people used to say I didn't look human because of my facial vitiligo, and I was just a kid. Kids can be really, really mean to each other, so that's difficult. All right. Any other questions? I think that this is really important, and we do need different outcomes, as you mentioned from your study, that we need something consistent. The heterogeneity of the measures really makes it difficult to compare studies and develop strong conclusions. And this was from Dr. Rodriguez. You worked with Michelle Rodriguez in Melbourne?
Yes. Yeah? Yes, in Melbourne, yeah.
Excellent. Good. I want to visit someday. Thanks for coming.